Good evening, guys. Here's your B for today. Discussion B is discussing dementia, now feared more than cancer. Captures a shrinking shift in public attitudes revealed by new UK survey data. According to the Home Instead poll, 31% of adults now identified dementia as the illness they fear most. By contrast, fear of cancer, long considered the most deadly diagnosis, has dropped from 30% to 21% in just a year. Among family careers, the fear of dementia is equally pronounced, with 31% reporting it as their greatest health concern. This marks a cultural turning point. Dementia is no longer seen as a niche or age-specific issue, but as a looming public health crisis with profound social consequences. Why fear of dementia has grown. Loss of self-identity, unlike cancer, which is often framed in terms of survival rates and treatment breakthroughs. Dementia is perceived as stripping away memory, personality, and autonomy. The idea of losing oneself resonates deeply and evokes external dread. Treatment and research gap. Cancer research is associated with progress, new therapies, survivorship stories, and public campaigns that emphasize hope. Dementia is still widely seen as an area with limited treatment options and slow scientific advances, reinforcing a sense of helplessness, families, and financial burden. Dementia is not an individual illness, but a family-wide challenge. Caregiving demands are long-term, emotionally draining, and financially costly. The survey reflects how these ripple effects intensify fear among carers and the public, raising prevalence awareness. Public health messaging has underscored projections that dementia cases will rise by more than 40% by 2040. This looming increase makes dementia feel like an unavoidable societal challenge, magnifying anxiety. Supporting survey supporting surveys and attitudes. This trend is not isolated. Alzheimer's research, UK's dementia attitudes. Mere Monitor 2025 found that dementia consistently ranks as one of the most feared conditions, with concerns about diagnosis, delays in treatment, effectiveness, and stigma. Earlier studies by Alzheimer's Society revealed that many people avoid seeking diagnosis because they equate dementia with the end of meaningful life. These findings highlight how fear is intertwined with misinformation, stigma, and lack of visible pathways to support policy and campaign implications. The growing fear of dementia is being levered by campaigners and policymakers to demand action. Research investment calls for dementia research finding to match cancer research levels, accelerating drug development and non pharmacological interventions, prevention strategies, greater emphasis on lifestyle based preventions, diet, exercise, cardiovascular health linked to reducing dementia risk. Diagnosis pathways, improving early detection and reducing stigma around seeking help so families can access support sooner. Care infrastructure, expanding home based and community centered care models to reduce the burden on families and health systems. This shift in public sentiment reframes dementia as not a medical issue, but a national priority requiring systematic reform. Bottom line. The headline, Dementia is Now Feared More Than Cancer, reflects more than statistics. It signals a profound cultural and psychological shift. Dementia is feared because it threatens identity, independence, and family stability, while progress in cancer care has softened its image, with prevalence expected to surge. This fear is fueling urgent calls for stronger national action, research, prevention, and care. In essence, dementia has become defining health anxiety of our time, reshaping both public discourse and policy agendas. Okay, guys, so that is it for tonight. I will see everybody Monday for shows. For now, Gator Wellness. Take care, folks.